guys, welcome back to RHP, and today we are privileged once again to have Dr. Aswani join us. Daktari, karibu sana.
Thank you very much. It's always a pleasure to be on the program.
Thank you so much. Thank you for making time.
Yes.
And today we want to talk about menstruation.
Right.
And without wasting time, we'll go right into it. But first things first, if you haven't subscribed to the channel, go ahead and do so, because we give you nothing other than good health content that could be useful to you or to somebody close to you. So go ahead and check the contents that we've already shared. And so on menstruation, Daktari, what is the average age of menarche?
Yes, where menarche implies the age at the first menstrual bleeding.
Yeah.
Average age would be around 11 years. Most girls will get into menarche within the age range 9 to 15, but with an average of about 11 years. Yes, so that when it's earlier than 9, we consider that is come too early. Though of course then it's only if it's going beyond 18 years that we consider it to be late.
Okay.
Right.
Have you had cases where it started earlier than 9 yourself?
Yes. I've had one or two instances where I've had to manage young girls in whom it has started early.
Okay.
Now, when it starts too early, that is then when we talk about the condition called precocious puberty. Yes. Periods that come too early.
Yes.
Meaning that one hasn't quite reached the age where biologically they ought to, and so we are looking at it like it is an abnormality. Yes,
okay.
Then we call it precocious puberty. Right.
What do we call the one that comes late, that is after 18 years of age, if it has a name?
It doesn't have a specific name.
Okay.
Except now when you're looking at it that one has failed to get periods.
Yes.
At which point then we will call it primary amenorrhea. For instance, if we encounter a girl or a lady who is, say, 25 years,
yes,
and has never ever had menses,
yes,
then the condition we diagnose will be primary amenorrhea. Yes. But if previously one had periods and then they have disappeared for more than 6 months, and then we call that secondary amenorrhea.
Okay.
Yes.
Oh. Sometimes they disappear for more than 6 months.
Yes, they can.
Okay.
Of course, at that point in time, then we are looking at it as a disorder.
Yeah.
It's not part of normal biology. It is now a disorder at that point in time, and there are various conditions that can lead to that.
Okay.
Yes.
Okay. Are there any health significances of when they come earlier or when they come late? Does it affect the ladies in any way?
Not exactly.
Yes.
However, the presumption most often is that when they begin early but within the right time frame,
yes,
they potentially might indicate a relatively higher level of fertility compared to those in whom they come late.
Okay.
In fact, for ladies where periods are delayed,
yes,
we advise that when they have opportunity to get children, they should go right ahead, because the possibility is high that in fact their periods could disappear earlier.
Oh, okay.
Yes. So when they start early, they end late. When they start late, they end early. In a number of persons.
Okay.
Yes.
Wow. And what's normal in terms of the volume of the menses, the duration it takes? I know it differs from one person to another.
Right. Now, I don't know whether to answer it in the context of absolute measurement. When you're thinking absolute measurement, we'll be saying about 60 to 80 cc or mils. However, clinically, I mean,
Yes.
you know,
I
it's
didn't even know it can be measured. Sorry to cut you off.
well,
Yes.
some people have used menstrual cups for as what they would use at the time of
Yes.
menses. In which case, then they can collect. But of course, it's difficult. So majority of times when we want to estimate whether the flow is okay or is too heavy or too little,
Yes.
we look at it in terms of the number of pad changes or tampon changes on their heaviest day.
Okay.
So that if on the heaviest day one can do 3 changes, soaked, not overflowing,
Yes.
during the day,
Yes.
probably that will be considered okay. When you start going beyond there, then it's too much.
Okay.
But of course, if one doesn't soak a full pad on the heaviest day, then it's too little.
Okay.
Yes.
Yeah. And I agree. I would agree because my heaviest day will be day 2 usually.
Yes.
And when on day 2 I don't have much menses coming out, then I know overally I'm not going to have a longer or rather a flow which is
right. So that is in the context of the volume.
Yes.
But the number of days, majority of people will have it coming for 3 to 5 days. A normal range can extend to 2 to perhaps 7-8 days. If you're going beyond 8, then it's prolonged. If it's less than 2 days, then it's too little.
Okay.
Right.
And prolonged menses, is it significant? Does it imply there's something wrong?
Usually, yes.
Yeah.
Either in the context of the causation,
yes,
but equally also in the context of the effect it has, because then we bleed for a long period of time, then you lose more, and perhaps you might have the next period coming after a relatively shorter period of time, in which case you will not have given the body sufficient time to recover what had been lost, and so progressively then you can go into anemia. A good majority of times, and previously they have been a normal duration and they are getting prolonged, then usually there will have to be some element of hormonal imbalance somewhere. Yes, in the background.
Okay.
Right.
And majority of ladies who still have their menses experience cramps. Some do, some don't.
Right.
And how normal is the cramp phase, and at what point should they seek a doctor's advice on that?
It's difficult to characterize cramps as normal, because if we say they are normal, then those who don't get them then become abnormal.
Yeah.
All right.
Yes.
So that an element of cramping can be explained, but we consider it significant if it reaches a point that one requires to use some medicine. If it's there, but some discomfort, but really does not cause one to need to take medicine, then we look at it like more or less okay, more or less acceptable.
Yes.
But those who don't receive cramps then are not abnormal, they're still normal.
Yeah.
If consistently one has to take medicine, then probably they say there may be need to do something about it, or at least evaluate to find out is there anything beyond the usual that could be responsible. And there can be a number of things that can be responsible for severe cramping.
Okay.
Right.
You mind mentioning a few?
All right.
Yes.
Severe cramping can relate to either the chemicals that initiate menstruation, or the space within the cervical canal, or the quantity of bleeding.
Okay.
Normally, menstruation is initiated by chemicals called prostaglandins. They're the ones that cause changes in the blood vessel supply, that inner lining, so that then those blood vessels will break, and as they break, then the tissue that they were supplying then breaks off with the bleeding. those prostaglandins
Yes.
also have the characteristic that they can make the uterus contract. In fact, they are the same chemicals we use to induce labor in those who delay to go into
Yes.
labor.
Yes.
So if they are in excess amounts,
Mm-hmm.
then they make the uterus contract strongly.
Yes.
Obviously, they are important in the context of not only initiating the flow,
Mm-hmm.
but they aid. A little bit of push will
Yes.
ensure that whatever is loose in the uterine cavity gets out in good time.
Okay.
But when they excess, then they make the pumping
contraction.
action. There is a very strong to the point of giving
That's the
pain.
pain. Yeah.
So excess prostaglandins can be a reason.
Okay.
Now, we know that the space in the cervix allows for communication between the cavity of the uterus and the vaginal canal. If that space is little, then the loose material within the cavity is not exiting at a fast enough pace. And anytime you appear to distend that uterine cavity, that itself stimulates the muscle to contract. And when it contracts, then you get the cramping.
The pains.
Yes.
Yeah.
And in fact, it is people who have pains from these that
Yes.
would then usually benefit from a fast vaginal delivery.
Yeah.
Yes, because after delivery, then the cervical canal remains a lot more wider, and so now the passage is easier, so the muscle doesn't have to contract to push it out. And finally, those who would have very heavy periods,
Yes.
because the whole lot can't get out quickly enough, the longer it stays there, the more it undergoes clotting, and once it forms those huge clots, then it's even more difficult for the clot to pass
come
through.
out. Yes.
And so it really has to be pushed.
Yes.
And that's why now they'll have to have
Pains.
And
Because it's trying to push them.
yes, so as the clot forms, the
Yeah.
pain increases, reaches peak. Then when the clot comes out, then the pain eases
Yeah.
until another clot forms. And then you go through the cycles
Until you finish.
right.
Wow. Thank you. I didn't
Most
know
welcome.
that.
Yes.
Thank you. Now, what is the average time when menstruation ends? We call it menopause.
Right. On average,
Yes.
we expect around the age of 50 years, with a range of 45 to 55.
Yeah.
Yes.
That's good news.
Is it?
I think so. Yes. It gives ladies. It gives women more time to decide what they want to do with their body before that time comes.
All right.
Yeah.
Yes, so that is the normal range biologically, 45 to 55,
Yeah.
with the average of 50. Some people they can delay,
Yes.
some people they can, it can come prematurely.
Okay.
Yes.
Wow.
So that if you get periods disappearing prior to the age of 45,
Yes.
but after 40,
Yes.
then we would call that early menopause.
Okay.
If we are 35 and above,
Yes.
then it's premature
Okay.
menopause.
Yes.
But if they disappear entirely and we check and we do not find any possibility of ovarian
Yes.
activity
Yes.
before 35, then we just call it ovarian failure,
Okay.
because it's no longer biology. It's now a disease process, a disease entity, because there's no way you can explain
Someone not having periods at the age
of 35 and under.
And under, yeah.
Yeah, we are still very much in the active reproductive years, so
Yes.
that will be considered an abnormality, but
A disease, yes.
yes, a disease process, so to speak. But if it is above 40, I say okay, some things can happen a little sooner, but at the right times, 45, 55.
Okay.
Yes.
Those who get them between the age of 35 and about around 40 or less than 45, is there anything that can be done to, to take it back, or rather to correct the disorder, because the average age should be between 45 and above?
I think if you go back to the definition of menopause,
Yep.
it is that it is when periods have ceased to come because the ovaries are no longer functional. as it were, it's like we have exhausted all the eggs that one had. Now, there's no way anyone can create any more eggs and put in that ovary. And so you cannot correct the condition that is menopause. However, if somebody then has symptoms that come as a result of menopause, then there can be that aspect of trying to relieve those symptoms. Yeah, but not that you return their fertility back. No. No.
I thought we could get their fertility back when it's trying to escape them.
That one,
Not possible.
until technology develops, perhaps people keep on talking about stem cell technology. We don't know whether we'll reach that point where we can regenerate them, but as of now,
nothing much can be done.
When it's gone, it's gone.
Okay.
Yes.
Okay. So we'd rather do what we can do while they're still here.
Yes. Okay. The only thing technology appears to be able to assist is in the context that if one is aware or has plans that they will delay they are initiating childbearing, and they want to overcome that fear that potentially their ovaries could give up on them before they are there. They can actually get their eggs removed and frozen and stored within IVF centers. They do have that facility. One can get their eggs stored so that they can be used up later within the context of again fertilizing them outside the body, so that you just put back the embryo in, but not that you return the eggs into the ovaries.
Into the ovaries. That's impossible. Okay.
All right.
Thank you so much. It's been a pleasure.
Yes.
Guys, again, if you need to see Dr. Aswani, he practices at Upper Hill at Professor Nelson Awori Center, 3rd floor. So go right ahead and see him if there's a need. And let's meet on the next episode. Thank you so much for joining us.
Most obliged.
Okay.
Yes. Thank you.